So can you explain very briefly what IPPR is proposing here?
Well, we think we need a new approach to public service reform because there are a growing range of complex social problems such as long-term unemployment, such as mental illness, such as reoffending, which require a different approach. Just delivering public services in a highly centralised way in very narrow functional silos from Whitehall doesn't work when you're trying to tackle these kind of complex problems. So, for example, why is the work programme so bad at getting long-term unemployed people who have sickness or disabilities into work? And the reason is because it's a very narrow job-focused programme that doesn't address all the barriers to getting people into work, such as low skills, poor self-confidence, mental health problems, and so forth. So you require a much more integrated approach. That means three things. First, it means devolving power down to the local level so that there's more local control over the decisions. It involves pooling budgets at the local level, at local authority level or city regional level, so they can look at a whole person or a whole place, so you can tackle these complex problems properly. And thirdly, it means developing much stronger relationships between the user of the service and the professional on the front line, so that people have strong and consistent relationships that can really get a grip on the kind of complex difficulties they're facing.
These may well be better services, but they sound like they're very expensive services.
Well, this is a way of both trying to improve services and save money. And that's first of all because we want services to become more preventative. So what we want to do is hand budgets down to the local level so that local authorities can have a longer period in which they can have confidence about their budget. They can bring funding forward to invest in preventative measures so that you can prevent problems happening in the first place. So, for example, in the health service, what we need to do is give local managers a long-term budget, 5-year budget, which can allow them to plan. They can bring forward money in the first few years so they can invest in caring for people better in the community and in the home, so that they don't end up in expensive and unnecessary visits to hospital. So this is a way of trying to prevent problems and therefore saving money. The other thing about the productivity of public services here is that there are some public services which are very transactional, where you just want a quick exchange in and out, paying your parking permit or paying your council tax. And we should be doing much of that online. We should be automating many of those services so we can reduce the number of people working in those transactional areas. And then we can use that money to invest in the services which do require paid professionals to have intensive relationships with people. So automate on the transactional side in order to sustain investment in the more labour-intensive relational services.
Making change happen in the public services is notoriously difficult. What's been the reaction so far from politicians, policymakers, people in Whitehall, perhaps above all people who work in the public services?
Well, I think for people who work in public services, there's a real appetite for this because they are, sick and tired of having to comply with central targets and central diktats all the time. They actually want to be able to have the flexibility locally to innovate and to really respond to the needs of the people they're serving. They also are sick of working in silos, which means they can't deal with people's problems effectively. So I think there is a lot of appetite for this at the front line. I think for many years politicians haven't trusted the front line, so they get a bit nervous about handing away money and power and responsibility. But what I say to that is, there is no other game in town. You have to save money. This is a much more effective way of saving money than just lopping off 10% off the Department for Work and Pensions or the Education Department. And so handing money down to the local area means you can both try to sustain the service and make more effective savings. So the fiscal pressure on politicians means that I think now there is at last some appetite for devolving more power and responsibility locally. The condition for making that work is that we hold people to account for the outcomes they achieve. So it's not just handing money down and letting people do what they want, it's handing money down but then being clear about what you're expecting in terms of outcomes.